Welcome to COIQ, where you learn how health innovators maximize their success. I'm your host, Dr. Roxy, founder of Legacy DNA and international best-selling author of How Health Innovators Maximize Market Success. Through candid conversations with health innovators, early adopters, and influencers, you'll learn how to bring your innovation from idea to startup to market domination. And now, let's jump into the latest episode of COIQ. Welcome back, COIQ listeners. On today's episode, we have Katherine Jin with us, who is the CTO and co-founder of Kinnos. Welcome to the show, Katherine.
Yes, thank you for having me. I'm really excited.
Yes, me too. You are doing some incredible stuff these days. Tell our listeners and viewers a little bit about your background and what you're innovating.
Yeah, so my name is Katherine Jin. I started a company back in 2014 at the height of the Ebola crisis with two of my best friends from college. And the company is called Kinnos, and our main goal is to reduce infectious disease outbreaks across the world in any setting, whether it be the current epidemics that we're observing right now with COVID or Ebola back in 2014, or hospital-acquired infections that just occur on a daily basis in regular healthcare settings. So we started the company back in 2014. Columbia held a design challenge, which was kind of their version of a hackathon, where they brought in actual healthcare workers from the field, from Liberia and Guinea, who told us what problems they were facing. And one of the most pressing issues mentioned was that human error and ineffective disinfection was leading to high rates of infection transmission. And if only there was some way to see what they were doing. So now Kinnos, our main goal is to improve the use of disinfectants, to empower people to actually use disinfectants correctly every single time we use it. And we do that by colorizing disinfection.
So I normally don't delve too much into the product because, most of the conversation is around, the whole business strategies and tactics and commercialization. Mm-hmm. But what you're doing is so timely and relevant for what we're all facing right now. So if you don't mind, just to give a little bit more color and context, what is the difference between what's happening now without your solution and then how your solution changes that?
Yeah, okay. So disinfection.
Because it's scary and exciting at the same time.
Yeah, lots of people. I never knew I'd be working on disinfection. It's hard to say that I have when I was younger, I had a passion for it. But now that I know how important it is, of course I'm passionate about it.
Yeah.
So there are a couple major problems with disinfection. This happens again, regardless of whether or not you're in the hospital for just a routine surgery or in an epidemic setting. So the problem with disinfectants are they're transparent, so you can't see where you're applying them. So you only need one teeny weeny spore to be alive on that surface to infect you and possibly ruin your life. Mm-hmm. And so therefore, if you're not covering every single inch of that surface, you're basically not doing anything. The second thing people don't know about disinfectants is disinfectants require a contact time to actually work. So for example, during the Ebola crisis, the contact time for bleach to kill Ebola was 10 minutes. And when we went to Liberia and Guinea and we spoke with doctors and nurses, no one was waiting that 10 minutes. Mm-hmm. If you don't wait for the right amount of contact time to elapse, nothing is killed. And again, this happens in U.S. hospitals with hospital-acquired infections all the time. MRSA, C. diff, et cetera, et cetera. You want to put bleach or a similar disinfectant down on a surface for 3 minutes and wait for the 3 minutes to elapse before you touch that surface. But unfortunately, it's very difficult to know when 3 minutes have passed. It's very difficult to know if you've covered every aspect of the surface. Yeah. So therefore, what we've invented is Highlight. It's a patented color additive platform that is combined with existing disinfectants that are already widely used. So Highlight enhanced disinfectants are colorized, so you can see exactly where you have and have not colored. And then the color fades from colored to colorless after a few minutes to approximate when disinfection is done and the surface is safe to touch. So Highlight overcomes language, education, and training barriers and immediately enables a completely untrained person to correctly disinfect surfaces every single time a disinfectant is used.
So it's just absolutely incredible. And like I said, scary as well, because when you think about what goes on in a hospital setting every day, like you said, when a pandemic is not happening, it's really scary to know that, but yet exciting to know that there's a solution like yours out there. And so because of that, like this solution was just as important prior to our COVID crisis as it is now.
Yes, exactly. I think the main thing I want to emphasize is infectious disease prevention isn't something we should only be thinking about during times of an epidemic. Millions of Americans every year, millions of people globally are affected by these infectious pathogens. So let's say you go to a hospital, less than half of critical services in healthcare settings are properly cleaned. So that's already a huge amount. If you're going to go in for a small routine surgery, let's say you just need to get some stitches or something, or just get an IV put in, you're not expecting to come out of the hospital with a life-threatening illness, right?
Right.
But that's what happens if you get C. diff. We met a patient that came in just for a little tiny surgery, and he was in the hospital for 2 years because he couldn't fight off that C. diff infection. So
and it can be deadly.
It can be deadly.
Yeah.
Yes, exactly. And increasingly in this interconnected world, we are really not doing a good job across the board in protecting ourselves from infectious diseases, as everyone can clearly see with what happened with COVID-19. You know, proper decontamination doesn't only need to occur in hospitals, it needs to occur in food settings, travel settings. You know, right now the MTA is cleaning the subway carts every night. I argue that they should have been doing that already. And I think to prevent COVID-19 in the future, they should do that all
the time. Oh, yes, the grocery store carts too. Ah.
Yeah, there are so many things we encounter every single day. We don't realize how many people have come into contact with and are honestly so contaminated.
Yeah.
So it's
and
really
it's invisible.
To clean well.
And it's invisible, so it's so scary because you don't see it. It's
exactly. It's easy to not be afraid because you don't actually see the problem until one day you're sick. There's no actual enemy you're fighting, so it makes people complacent. And I don't think it's people's fault. I think disinfection is just hard in general. It's a topic that people think sounds easy, like, oh, get a Lysol wipe down the kitchen.
Write it down,
blah blah blah. Yeah, easy peasy. But even Lysol wipes, everyone uses wrong. If you look at the back, it says you need to wait 10 minutes for it to disinfect a surface. I do not think anyone has ever waited 10 minutes for a Lysol wipe to sit wet on a surface. I don't even think they can sit wet that long. So
absolutely right, exactly. If it sat that long, it'd probably dry out.
Yeah, exactly. So yeah, just in general, disinfection is hard. Decontamination is hard. We're giving this job to EBS workers in hospitals who are often undertrained. They're working multiple jobs, and they have to balance a lot of things. They not only have to make sure the room is super, super clean, they also have to make sure the doctor can come in and out, the family can come in and out, and they have to turn over a massive number of rooms in a tiny amount of time.
Yeah.
So giving them a better tool hopefully will improve disinfection across the board.
So let's just kind of rewind a little bit and go back to, okay, wow, this was a college idea that started off as a hackathon.
Yes.
Which is so incredibly exciting. What has your journey been like over the last 3 years? The ups and downs, the game-changing decisions and wins, and some of the challenges that you faced.
Yeah. So transitioning into an actual company versus a school project or a school startup, that requires a lot of work. Yeah. I think a lot of people in college want to start startups, and a lot of people want to do their own thing. But it really does come down to, at the end of the day, your own personal level of commitment. So me, Jason, and Kevin, we went all in. When we graduated, we knew we were only going to be doing Kinnos. That was going to be our only focus. And I think that was very good, but it was also very stressful because right when we graduated, we knew we had to raise an outside round of funding. Up until we graduated, we had been funded primarily by grants and competitions. So we had taken no equity funding, but we knew to reach the next level, to implement our next product, which is a Highlight Wipes product for US hospitals, we need to raise money. And so, that was obviously a very, very interesting challenge for 3 recent graduates. I hadn't ever made a slide deck for a company before, and we used to go to meetings with potential investors and not even know how to ask for money. We'd have a whole lunch, and at the end of the meeting, I don't know, I was like, am I supposed to say, are you going to invest in us?
Right.
I don't know what's the next step here. And so it took a long time to raise that first round. Obviously, it took pretty much all of 2016. We closed around in 2017. And then we started working on our product development. So our first product, Highlight Powder, we've already completely finished it. It's on the market. It's for use with large bleach solutions. So primarily in epidemic settings like, cholera or Ebola. However, U.S. hospitals use bleach wipes, and tons of consumers also use bleach wipes. So we pivoted the product a little bit so that we could also work with bleach wipes. And that required a massive amount of additional R&D and also proving that it actually works. It's simple to say you have a product that works, but it's really hard to make people believe you, especially if you're young and you haven't had a product like this before. So we also had to conduct a lot of outside studies, clinical tests, working with a lot of different universities and other organizations to bring legitimacy to the efficacy of the technology. But I think, basically what I learned so far is that you just got to do all your homework ahead of time and anticipate every single possible question someone will ask you. And if you show them that you're prepared, regardless of your youth or your inexperience, I think that can really say a lot.
Yeah. So what do you, and I so appreciate your candor. It's really wonderful because there's so many people that are listening to the show that go through similar challenges. And so it's very encouraging and inspiring to hear that there's someone else that's going through that too, right?
Yeah.
So when so what do you think was the difference between you pitching and getting no's and you pitching and getting the yes that you needed?
Yeah, so I definitely think the most important way to move forward, especially as a young team, is to look for good advisors. That should be your first goal coming out before you even begin to raise money. I know people always say, you need to have some gray hair on that team slide. Otherwise, people aren't going to take you seriously. But it is true. To get our foot into the door, we had to show investors and people we were speaking to that we were talking to the major key opinion leaders in this space. We weren't just goofing off and making a product without talking to anyone. We had Bill Rutala on our advisory board. He is the key opinion leader in infection prevention. He wrote the CDC guidelines. And, he's a really, really great person, of course, very smart. And so having his backing increases the legitimacy of the company so much. And so not just in a technical aspect, but also in a business aspect.
Sure.
None of us were business, none of us were econ or anything as undergrads. We were all technical. So we came onto the team as 3 technical co-founders. And I think it's really important to be open-minded about realizing what you need to learn. I think a lot of things as a scientist, I used to think weren't important, like slide decks or networking. I was like, who cares what's on this? Who cares what the slide deck look like? It just matters what's on it, right? Or who cares about networking? I want my work to speak for itself. But that is not how you do business. And so realizing, that I also had these wrong assumptions about how, things are conducted, and also, changing my mind, realizing that thinking networking is hard and I don't want to do it is a really limiting perspective. And so, in the very beginning, Jason, Kevin, and I used to go to networking events. We would show up. We'd be the only kids there, the only Asian kids there. And Jason would make us split up and go join other groups and just force our ways into those conversations. And I hated it so much. But it was so important. You got to be putting yourself out there, constantly meeting people, especially if you haven't done it before, because the more people you have on your side with experience, the more seriously people will take you.
Yeah. Yep. Absolutely. No doubt. So let's talk about proof and efficacy. So this can take a lot of time and it can take a lot of money and be a very painful process. Yes. So talk about your journey in this endeavor.
Yeah, so as I said already, we came in as 3 technical co-founders. So Jason, Kevin, and I had a kind of an idea of what we believed was technical legitimacy in this space. However, the classic saying, don't make assumptions, we made an assumption from the very beginning that because we were a private company, we could not publish or share our data in a way that would be peer-reviewed and legitimate. No matter what, we thought it would always look like an advertisement. It wouldn't be taken seriously. And so for the first couple years of working on Kinnos, we didn't even look at clinical data. Instead, we focused on efficacy data. And then, when we started pivoting to the hospital space and we realized, efficacy isn't enough. I can show them that it's going to kill C. diff every single time. But what I really need to show hospitals is that cleaning is being improved. So that's when we started engaging with hospitals and other partners, and also started writing our own papers. So generating our own literature on how the technology works, why we think it's novel, why we think it advances the field of infection prevention. I think one of the biggest lessons I've had just in general from Kinnos is that, like, if I'm not going to brag about myself, if I'm not going to put myself out there, no one else is going to do it for me. And so expecting people to come to you to talk to you, or expect people to just buy your product, or expect people just to know that what you're doing is cool will never work. You have to be putting yourself out there constantly. And most days, nothing's going to happen. Or most days, you're going to go to a conference and you think, wow, nothing came out of this. And then 2 years later, maybe you'll have a connection that will help with a licensing agreement, you know? So yeah. I think it's just really putting all the tendrils out there, not being too proud to go to, these meetings and talk to people and put yourself out there.
Yeah, I definitely think in any endeavor, but especially in entrepreneurship, we put 80% of the effort in before we even start to see any of that fruit come to fruition. Yeah. And most people give up.
Yes.
Right? They're like, this is not working. And they quit before. And you hear time and time again, story after story of, like they were so close to the finish line, but they just couldn't see it. And then they quit right before. So it's, you just have to keep after it, right? Persistence, determination.
Yeah. I think people just need to remember starting a startup sounds glamorous, but it is not the least glamorous lifestyle.
Oh, it's fancy, right?
Yeah, it's the least glamorous lifestyle.
So you also talked a lot about collaboration with key opinion leaders and different stakeholder groups. So share with us a little bit about that journey, because I think that you had a very enlightening experience that helped you pivot and change your product, like you said, from ideation, from really what was going to be viable in the marketplace, and to some of the features and functionality of that. So let's talk about that.
Yeah. So I think part of being a good startup founder is to be constantly looking for who your end users are going to be. So before even kind of any of the prototyping of our physical device began, Jason, Kevin, and I were in hospitals shadowing EBS staff, the people who clean the room, for days and days and days on end. And we watched them, we asked them their problems, we cleaned some rooms ourselves. And I think that gave us a really good understanding of what the actual pain points were for the end user. So at the end of the day, the most important thing about the product is that the actual person that's using it likes it and feels like they're doing a better job because of the product. And so it is always scary to talk to the end user, but I think what we learned is that put yourself out there. We email tons of people. We have connections from our university, but it was also a ton of cold emailing, bringing in professor connections, bringing in alumni connections, asking anyone, that we possibly can know, friends, family, do you have anyone in the healthcare space that is interested in infection prevention, or can you introduce us to a hospital? And once you get one foot in the door, it becomes so much easier. Once one hospital is working with you and they understand the value proposition of your product, getting other hospitals to be interested and buy in your product is so much easier. But I do think the most important thing is that you need, as a founder, to not only be engaging key opinion leaders and great advisors, but also to be constantly engaging the actual people that will be using your product. So, because at the end of the day, all the EBS managers told us, it doesn't matter if they don't like the product, we won't buy it. And so that came down to we had to make a product that people would actually use and people would actually like.
So what were maybe some of the assumptions that you made about what the product would look like versus what you learned when you shadowed them and really took that first-handed information?
Yeah. You saw me probably get excited because there was so much that we changed that it's kind of crazy.
Yeah.
I would say the first thing is we learned a lot about new problems. We didn't even realize a lot of these major issues with disinfectants until we started shadowing EBS staff. For example, disinfectants, the lids are really poorly, they're just cheap lids, right? So when you're an EBS staff, you have to pull out 10 of these wipes at a time, and it splashes in your face and it gets in your eyes, and no one would know this unless they actually are in there cleaning with 10 wipes, right?
Right,
and,
right.
By now I've had bleach in my eyes a million times, but the first couple times you realize this really sucks. I don't want this to happen.
Right.
So that was one problem with the lid. Another problem we found was that people, because the lids were so annoying to use, would just take the lids off. And then you have this horrible problem because bleach wipes can expire. I don't know if people know that disinfectants expire, but you always need to make sure that you use your disinfectant before the expiration date. And once you open it, you must close it completely. Otherwise, it will be totally useless the next day.
Yeah, so, dries out.
Exactly. So, we were talking to nurses and EBS staff who were telling us, that's a major problem. People will leave open buckets overnight. It's a waste of equipment. It's a waste of time. And at the end of the day, that's also endangering patients. And so those are two really interesting features that we hadn't even thought about for the product. Mm-hmm. And so I guess the biggest thing that changed was we initially came into this product thinking like, let's make a mechanical product. You just press a lever, you put blue on the wipe, you pull the wipe out, easy peasy, nothing complicated. We want to avoid batteries. But as we went through the process and we were talking to all these EBS staff, we realized A, disinfection was a lot harder than we even thought. Mm-hmm. So we have added all these additional features. And then B, at the end of the day, the product needs to work well and the product needs to be able to scale afterwards. So, even though we thought the mechanical product was easier and simpler to implement, when we actually did a study with EBS staff and EBS managers, the vast majority preferred the electronic version. And so being able to look at that data and say, okay, my assumption was wrong. Maybe I put a lot of time and also maybe a lot of money into another idea, but I also have to be, an adult and realize that the data is telling me something else and that I want people to use something that they actually like. So that really radically changed our product. I mean, if you look now, our product it's an electronic lid. It can pull the wipes back in so that the wipes won't dry out. It has additional features that we all added because of the EBS staff. And even though initially we didn't think the batteries would be usable for hospitals, what we've seen is that hospitals don't mind at all. So we had a lot of wrong assumptions coming in, and thank God we checked them all.
Hey, it's Dr. Roxy here with a quick break from the conversation. Are you trying to figure out what moves you need to make to survive and thrive in the new COVID economy? I want every health innovator to find their most viable and profitable pivot strategy, which is why I created the COVID Proof Your Business Pivot Kit. The Pivot Kit is a step-by-step framework that helps you find your best pivot strategy. It walks you through 6 categories you need to examine for a 360-degree view of your business. I call them the 6 critical pivot lenses. As you make your way through this comprehensive kit, you'll be armed with the tools, tips, and strategies you need to make sure you can pivot with speed without missing out on critical details and opportunities. Learn more at legacy-dna.com/kit. So, one of the things that I hear, Katherine, is that although although maybe there were some perceptions around, I'm going to say age, maybe being a negative, at least when it came to raising money, right? But I also think that your I don't know if it's just age, but like your young experience seems to have positioned you with an incredible sense of curiosity. And so instead of being kind of, I've been doing this for 20 or 30 years, I know what needs to be done. It sounds like you and your team have gone into this with a curiosity and an openness to really be flexible and agile for collecting that real feedback, which I think is incredibly important because most entrepreneurs don't do co-creation. And when they do co-create, majority of the time, it's after they've already designed the solution and they are just going in to get, it's confirmation bias. I am going to ask people to, yes, you like this? Yes, I like it. Just agree. So they really aren't seeking real feedback because it's a pain. I mean, I've been there where I've invented something and you put your heart and soul into it. You put all this money and effort, and then you realize that it's not you haven't reached product market fit yet. You need to do something different, and you're like, but there's so much learning there with the failure, right? It gives you the path to success, although it's really frustrating. So, I mean, I think that it's incredibly wonderful that you guys have been so curious and so open. I think that that's going to play a huge part in your success.
Yeah, I think I'm always telling people, future partners or new employees, that I'm a fallible human being. I don't know everything. And my goal is just to learn more. And so if there's any discourse or you disagree with me or you think something else, I want to hear that. Like I actively want you to tell me. So I always check in, especially with like my R&D team. And I ask like, is there anything you don't like or you like half don't like or anything you think is stupid? Like, don't be afraid to come to me and say, this is stupid.
Yeah.
I think, being humble and realizing that like being right all the time isn't important. What's actually important is progress and moving forward. And me being right really doesn't matter at the end of the day. And I think, because we started this as young people and, we weren't disinfectant experts, we weren't like infection prevention experts. And so initially all of the science, Kevin, Jason, and I learned kind of on our own by ourselves. And I think that was a massively humbling process where I came into it thinking like, how hard could like disinfection be? Like I took like organic chemistry. I could do any of this stuff.
I have Lysol at home.
Realizing that I really don't know anything. And a lot of things I learned in college, sure, they were helpful so I could learn more in the future, but they weren't like actually applicable to the real life situation. So I had to, begin again and realize that, I have to constantly be questioning what I know, questioning what I believe. And if I, allow myself to, if I maintain an illusion to myself that I'm right all the time, the only person I'm hurting is myself.
Yeah.
So I actively seek people to disagree with me.
That's beautiful. Absolutely. So, so let's talk about, I go to your website and I look at your recognition page and you've got tons of rewards, tons of PR. So what has that journey been like for you? And, obviously promotion is such a core part of commercialization. And so, establishing not just that efficacy and that safety and efficacy from a clinical setting, but also from a awareness standpoint. So what has been your experience in that journey and how has that benefited you so far?
Yeah, so I would say, my first recommendation to any student founders that are still in college is that there's a massive, massive network of free money waiting to be given to you, and then you can get really great PR from it. So there's like the Collegiate Inventors Competition, Lemelson MIT, et cetera, et cetera, et cetera. In our junior and senior year, while we were running Kinnos, we were just basically doing the competition circuit. And that got us connected with so many people. I met like the head of the patent office. And I remember when I was only like 18, that was like the coolest thing ever, that I was doing this woman. And also she was Asian American, so I was extra pumped.
Right.
Yeah. And so I think, I think students should definitely take advantage of that. And students, you don't have to just be an undergrad, you can be a master's student, you could be a PhD student, or you can even be affiliated with the university. There are tons and tons and tons of competitions out there that are specifically appealing to technical co-founders that are trying to transition their product, from a cool, interesting science in the lab to something that actually will, improve lives. Mm-hmm. So I would say, definitely keep an eye on that. I would also say another really important help for us was government funding. I think, positioning yourself so you can receive grant funding, for example, like an SBIR or, a Grand Challenge grant, which is what we got, helps a lot too, because then you kind of have these connections within USAID or whatever organization, NSF or whatever organization is running the grant that can help you get into these places who have experience already before as well. And so, the competitions and the accolades are all really cool. I definitely think like in the beginning when it was all happening, I was super psyched and I was like, oh my God, I can't believe I'm getting all these things. I can put them on my resume. But you also realize as, you graduate and you grow up that it doesn't really matter. I don't ever look at my resume. I don't even know the last time anyone has looked at it.
Right.
It really goes to show that, so those awards are cool, but the real important thing that came out of those were like the connections and the people that we met. So even if you don't win, it's just good to put yourself out there, constantly just be learning and meeting more people. I think that's the most important thing that we learned. I would also say, as I think a lot of people, again, go into the startup life thinking it's going to be glamorous. So people go into the startup life thinking, like, oh, I'm going to pull a salary. I'm going to do all these things. Like I'm going to, it's like a totally legitimate job, as if you went, to get a job at corporate, but that's not how it works. Like Jason, Kevin, and I didn't take salary like the first year. Like we were just like eating like eggs over rice all the time. We had a lot of like very funny experiences looking back, and I'm very lucky and privileged that I could start a startup after college. Like I didn't have to support my family or anything like that. But right. I think so realizing that you're going to have to make a lot of sacrifices if you want your startup to be successful. It's going to require a lot from you, and so just being aware that you're going to have to humble yourself many, many times in the upcoming years.
Yes, definitely. So I want to talk about timing. So, a lot of times, when you hear these successful startup or entrepreneurial stories, you hear, there's luck, and then there's definitely timing and so it's pretty darn incredible that your college project like 4 years ago led you to something that is so necessary, again, always, but even more at this moment in time as we're talking about the pandemic. So how when you think about your pre-COVID strategy and what's happening now, what changes have been made, if anything?
Yeah, that's a great question. I mean, I've been in the infection prevention space for a really long time. So, I hate to say it, but I knew an epidemic on a scale, like COVID was coming. And I also knew that we, as the world, were solely not ready yet. Yeah. And I think, the important thing is like being able to actually link your product to a problem. I think a lot of people design a cool solution or a cool gadget, and then they, kind of stick that into a problem and say that fixes that. I'm super guilty of that. I've definitely done that before. But since we started from the problem itself, it kind of was a guarantee that we knew this was a problem. We knew this was going to be a continued problem. And we knew that, it doesn't matter how much we advance as humanity, epidemics are still going to happen. Viruses and pathogens are still going to infect us. So definitely COVID-19, was a surprise in some sense, definitely how quickly it moved. But, in terms of Kinnos and also in terms of personally, I have been mentally prepared for this for a very long time. Mm-hmm. And in terms of our strategy, I think there are a couple things I want to say. I think the first thing I want to say is we have been trying to launch, a hand sanitizer product for a while now. And, we've been doing a lot of R&D on it, but, the regulations and the FDA, they're a little tough to navigate. And so we've been focusing mostly on our bleach wipes product. But because the FDA relaxed some guidelines around making hand sanitizers because of the lack of hand sanitizers, we were able to actually update our manufacturing chain and start producing hand sanitizers and start selling that as well. And, even though it doesn't necessarily have the Kinnos technology embedded in it yet, it's really setting us up for in the future when we do finally finish that research and can implement it. We already have a customer base, and people already know, like, Kinnos also makes hand sanitizers. And it also feels good to, like, actually be able making something that is helping right now during the epidemic. Everyone needs hand sanitizers. They're going to be everywhere post the outbreak. So I think, realizing that the world has changed and it's not necessarily, it's not going to return to what it was before. You're going to see like hand sanitizer bottles, like ketchup bottles, like on all the
right.
You know what I mean?
Forever. So, it's everywhere.
Yeah, exactly. So kind of being aware of where the overall trend is going, like maybe this wasn't really on our timeline in this year, but it accelerated the timeline because the timing was good. Yeah. And I think another interesting thing I'd like to talk about is we have a product right now that is being scaled up for manufacturing. We're just going through the highlight wipes lid, and we are launching at the end of July. And unfortunately, COVID hit how much sooner, like in April and March, right? Yeah. And so a very frustrating thing for our team and our co-founders was we have a solution, but we're just bound by just like timing and like plastics and like tariffs and manufacturing, and there's nothing I can do to make this go faster. And so just being patient and realizing that, even in the best timing, sometimes the timing still isn't perfect. And being agile and being able to adapt to that. So, even though I know hospitals have really been inundated with coronavirus cases, so it's not like the easiest time to go in and be like, hey, want to use this new product?
Right.
So we're just relying on a lot of our own network connections. We're relying on, a waiting list of the product that we've made. And so we've pivoted a little bit, kind of instead of like casting a super, super wide net, we're going to try and catch, more specific hospitals we know like use bleach, or hospitals we know that, we have good relationships with. So it's a little bit more targeted. But I think that moving forward, disinfection and infection prevention will only become more relevant. And so I think Kinnos, we're working on additional products for other disinfectants like quats and hydrogen peroxide. I want to make sure that, we have a product platform that can really address all possible disinfectants across the board.
Yeah. It's really smart. That is funny that you brought that up, because I was going to ask you about that. So supply chain is an issue, right? So even if you have the most incredible innovation right now, because we're in a global pandemic, supply chain issues are very pervasive right now. Yeah. And so are you taking pre-orders?
Yeah, I mean, we're taking pre-orders. I would definitely say, go check us out at kinnos.us. If you email the contact page, Jason, our CEO, will respond to you like in 5 minutes. So definitely we have a quick turnaround time. I think it's definitely weird to be working on something right now in this time. I have most of the people, are losing, I guess, their sense of normality, right? Like people are losing their jobs, or people, are not able to pursue the same path that they wanted to pursue before coronavirus. And I feel very fortunate and lucky that, we've been able to grow our team during this period. We've been just like pushing forward during this period. So even though it's really frustrating, some of our manufacturing is done in China. And when, all of China was locked down, that was like 2 months of nothing getting done in manufacturing. Yeah. And there's nothing we could do. Everyone's quarantined at home, So just, I guess, rolling with the punches. I think you really need to know, what is out of your control that you have to just accept and learn to live with, and what is in your control that you can push forward. And so what was in our control was looking at new suppliers, was contacting our suppliers, all over, and trying to find the right ingredients and bottles to make hand sanitizer. What wasn't in our control was, ramping up our manufacturing for our Highlight Lids launch, which is why, it's being launched in July now as opposed to a little bit earlier, which we wanted. So I think, pluses and minuses either way. I'm just trying to be realistic about the situation and not take anything personally.
So it sounds like you have a really, whether you've done this intentionally or not, it sounds like you have a really solid self-talk strategy to help you weather this mentally and emotionally.
Yes. I mean, we've been running this company now since 2014. That's 6 years. That's 6 years of like failures and accumulated embarrassments and like things that I did when I look back, I cringe, or things I look back and I'm like, that was so dumb.
Yeah.
I think, being able to talk yourself through the hard times is so important, because this happens so many times throughout Kinnos where like a problem occurs and I'm just like, is it all over? Is that it? Does it just end now? So I think,
and then 20 minutes later, 4 hours later, you get another call and you're on the mountaintop, right?
I know the drama of being a startup founder, it's insane. Yeah. So I think also part of that is not letting the highs get to your head, not letting your successes make you too happy. I think the award example is a great example. Like when you got awards, I think they were really cool and they were really fun, but we were always reminding ourselves at the end of the day, this is just an award. Like, to actually make an impact, we need to get this in hospitals. It doesn't matter what list we are on or what it says on our resume. It really just depends on actual impact.
Yep, absolutely. That's awesome. And speaking about impact, I think about, I think it's human nature that most of us want to make a difference in the world and make the world a better place, right? But you hear all the time about the millennial generation and, I don't just want a job. I saw my parents or my grandparents go to a job that they hated. And, for decades, I don't want to do that. I want a job where I feel like I can make a difference. And so I just think about the work that you're doing and how you're just, and how you're describing it. Like, could you make a difference in any more of a meaningful way than what you guys are doing right now? It's just really incredible.
Thanks. I mean, to be honest, I do feel a lot of imposter syndrome, especially when people say these kind words to me. I want to make an impact and I do want to make the world better. And when people, give me these kinds of compliments, the first thing I think is like, am I actually doing anything? Like, am I actually making the world better? Am I actually making an impact here? Like, maybe lots of people are just complimenting me for no reason. And so I guess kind of that feeling of never doing enough, that feeling of, wanting to do more, no matter what, that never goes away. And so, the real way to get rid of that feeling isn't to constantly just be seeking external validation, but also, be able to just find some peace within yourself and, see, I think what I've been able to realize, in this past year that I think has been part of my maturing, as an adult, is that my whole life is a journey, and that even if I can't get highlighted in hospitals by the end of this year, I have the next X years to push this forward. And so all the pressure I put on myself to be the best right now, making the most impact right now, it doesn't even make sense logically if you just look at the whole journey of life that I am yet to embark on. So
your whole life ahead of you.
Exactly. Yeah. So just trying to go a little bit easier on yourself too, and realize, it's interesting to read really cool things other people are doing, but your life is your own life, and its own timing will figure itself out.
Yeah, absolutely. I think, what is it that you guys just won the Newsweek's Best Infection Prevention Product of 2020? That's huge.
Yeah, thank you. I actually didn't even know we won that until I saw it on our website. I was like, whoa, that's really cool.
You can tell that you're in the technology team and not the promotional team, right?
Oh, yeah. I rarely get these good news come to me intentionally. Usually I just find out later. I'm like, oh, that's really good.
Yeah. Well, and I think that what you described is that push-pull of entrepreneurship. And it's something that I think that if it's in your DNA, we have a tendency to struggle with that just forever between, celebrating the successes and, but also it's almost like, it's not a perfectionism, but it's almost like the energy that propels you to continue, to stay persistent and determined, to weather all of these obstacles that you continue facing. It's that is the fuel that ends up being key ingredient to your success. But at the same time, it has to be balanced somewhat to where we're not always living in the future and the next, that we don't celebrate the present moment and what's happening right now. Because like you said, it's a journey, but we just keep wanting to get to the destination, right?
Definitely. I'm not perfect at that. I'm not really good at it actually at all. I definitely think work-life balance or going easier on myself has been something I've had to learn the past couple of years. It's kind of stressful as a startup founder, because you're if no one's working, if I'm not working, no one's working, if I'm sleeping, no one is doing what needs to be done. And so taking kind of even any kind of break, to eat lunch or talk to a friend, I'm just the only person I'm hurting right now is myself. What am I doing? But, we have to give ourselves those little allowances. And I think for me, at least, it's just remembering that as a human being, I'm so fallible. So expecting any level of perfection from me is impossible. So
absolutely.
Expectations.
And continuing to surround yourself with people that have walked this journey and learned a lot of these lessons to be to be able to communicate and go, yeah, I was there too.
Yes.
And I promise you, this will just be a blip on your radar in 20 years and 10 years, right?
I really hope, I guess I don't want to repeat any mistakes. I how history always repeats itself. I think that's true. Every 100 years we have a completely different population on the earth, and we do the same exact thing we did the last 100 years.
Yes.
So I'm really trying to get out of all of our advisors and all of our great partners. I want to understand all the lessons learned so that I don't have to,
I don't want the hard way.
Own rabbit hole.
Exactly. Yes. Absolutely. So as we wrap up here, is there anything else that you would want to share with our listeners or our viewers who are in the trenches right now, maybe at different stages? Maybe they've been able to pivot to a COVID solution, or maybe they haven't, and they're still questioning right now whether they even have a relevant business going forward. Anything that you want to share?
Yeah, I would say the first thing is something that I remind myself all the time is that even if Kinnos fails tomorrow, it's not necessarily a failure for me. How much I've learned over the past couple years, the people I've met, the stuff I've been able to do, the places I've been able to go, those are going to be with me forever and, have contributed to the person I've become. So trying to I think being able to have that kind of perspective and take a step back and realize, even if it wasn't COVID, it could have been something else. Startups really, really don't succeed that much. And so you have to, as a startup founder, trick yourself into at least being comfortable with some level of what we would call as failure. But I don't think it's failure at all, because it was clearly a learning experience that, I got so much better at. And I think the other thing I would say is that, during this time, I think disinfection is super, super important. And our CEO, Jason, wrote a really, really great blog post on our website about how to properly clean surfaces and how that's relevant for people during this time of COVID-19. And it has nothing to do with Kinnos, it has nothing to do with Highlight. I just want people to use disinfectants correctly, and I want people to feel safe. So if anyone's also interested in learning a little bit more about how disinfection can help you protect yourself against COVID-19, you should check out our blogs on our website too.
So tell our listeners and viewers your website, and also if they want to get in a hold of you, what's the best way to get in contact?
Yeah, so our website is www.kinnos.us. You can reach me at my name, Katherine at kinnos.us. But if you also just contact us through the form online, I guarantee that I will see that email in 1 minute. So I'm very easy to reach. I'm always excited to talk about disinfection, whether or not it's related to Highlight or not. This is just a space that I'm really interested in. So, would love to connect with anyone that sees any relevance or thinks anything that we're doing is interesting.
Thank you so much. I love your energy. I love your transparency, and it's been a pleasure to have you on the show.
Thank you so much. Thank you for having me. This was really fun.
Thank you so much for listening. I know you're busy working to bring your life-changing innovation to market, and I value your time and your attention. To save time and get the latest episodes on your mobile device automatically, subscribe to the show on your favorite podcast app like Apple Podcasts, Spotify, and Stitcher. Thank you for listening, and I appreciate everyone who's been sharing the show with friends and colleagues. See you on the next episode of COIQ.